Welcome to this deep dive. And we're going to be talking about psychedelics and oncology.
Yeah.
Specifically, looking at how these substances can potentially help manage existential distress
Right.
and improve the quality of life for patients who are facing some pretty serious illnesses.
Absolutely.
So we've got a lot to unpack. We've got
Yeah.
research, we've got some clinical trials, we've got...
Molecular biology.
Yeah, we're going kind of deep into the molecular biology today.
We are.
So I think one of the things that really jumped out at me was this idea of set and setting when it comes to psychedelic experiences.
Yeah.
And I know you're kind of interested in exploring psilocybin therapy.
Mm-hmm.
This concept of set and setting seems really relevant for you.
It is. Yeah. It's
Like, how does that...
the environment, your intentions, the support system,
Yeah.
all of those things are so crucial.
It's not just about taking the drug.
It's not just about taking the drug.
That's about everything around it. Have you thought about what kind of setting would feel like the safest and most supportive for you if you were to pursue this kind of therapy?
That's a really good question, I think. For anybody who's considering psychedelic therapy,
Yeah.
it's not just about the substance itself, it's the context in
Yeah.
which it's used.
Absolutely.
That's what really matters.
Now, we've got some research here on MDMA-assisted psychotherapy for PTSD.
Okay.
Now, this isn't directly oncology related,
Right.
but I thought it might be helpful just to see how MDMA is being used therapeutically to kind of address emotional challenges.
Yeah, no, I think that's really valuable to look at because what we see with the emotional benefits that we see in those trials with MDMA could be really, really relevant for somebody going through the anxieties that come with a cancer diagnosis.
Makes sense. And there are some potential side effects, right, with MDMA. Like anxiety, fatigue, blood pressure changes, and those things would need to be managed really carefully.
Yeah, you're absolutely right. I think the potential of MDMA is exciting, but any therapeutic use really requires that we carefully consider the risks and the safety protocols.
Yeah, for sure. Now, let's kind of shift gears a little bit here and go into the brain science behind all of this.
Okay.
This is the part that I think I geeked out on the most when I was reading through your notes.
Right.
So have you ever heard of the 5-HT2A receptor?
It's a key player in all of this.
Well, yeah.
It's how we experience and regulate emotions,
Okay.
like a volume knob for negative emotions.
Interesting.
A lot of these psychedelics, including psilocybin, they interact with this receptor.
So some research suggests that psilocybin might actually be like turning down the volume on that,
Yeah.
helping people kind of process fear and anxiety differently.
Hmm.
Could this be why these substances are showing some promise when it comes to managing that existential distress?
That's what researchers are really trying to figure out.
Yeah.
It's complex, but the emerging evidence points to this 5-HT2A receptor and its role in fear processing and emotion as central to understanding the potential here.
That's incredible.
Yeah.
It makes you wonder about the long-term impact on someone's emotional well-being,
Yeah.
especially for those facing a life-limiting illness.
Right. And how reframing your relationship with fear and negative emotions could be so transformative.
Absolutely. And it's not just psilocybin, right?
I know.
You mentioned LSD
Yeah.
in your notes.
Mhm.
So LSD, does that also interact with this receptor?
Yeah, it's thought to work through that receptor, although it has kind of a different way of interacting with it.
No.
LSD seems to change communication patterns within the brain,
Uh-huh.
especially between areas that are involved in emotional processing and higher level thinking.
So we're kind of seeing a theme here.
Yeah,
Different psychedelics,
right.
but maybe working through similar pathways in the brain
Exactly.
to affect how we manage emotions.
Exactly. And understanding these pathways is essential to developing safe and effective therapies because it's not just about what these substances do, it's about how they work on a biological level, right?
Yeah.
We need to know that.
We need to know that.
So all of this understanding of how these substances work in the brain, it kind of leads us to some exciting developments in clinical trials.
Yeah.
Particularly those that are looking at psilocybin in palliative care settings.
You're right. I was really struck by that study that you shared where a single dose of psilocybin led to these significant reductions in anxiety and depression in patients who had advanced cancer.
Mm-hmm.
What really stood out to you about that?
I think the fact that they saw these effects months after treatment,
Wow.
that's pretty remarkable.
Yeah.
We're not talking about temporary relief. It's
Wow.
a potential shift in perspective that could have lasting benefits for these patients.
So it's not just about masking these negative emotions, it's potentially facilitating a deeper change
Yeah.
in how someone relates to their illness and their well-being.
That's a good way to put it.
Some researchers believe that psychedelics might help patients actually confront their fear of death,
Yeah.
allowing them to process and accept their mortality.
Mm-hmm.
Could that be a key factor in those long-term reductions in anxiety and depression?
I think so, because if you're less afraid of dying,
Yeah.
you can focus more on living.
Right. And that goes back to what we were talking about with reframing our relationship with those negative emotions.
Absolutely.
Now, you mentioned existential distress
Mm-hmm.
in your notes,
Yeah.
especially in the context of cancer patients.
Right.
What does that term mean for you?
Well, I think
Is it the fear of death? Is it a loss of purpose? Or is it something else entirely?
for me, it's about grappling with those big questions of
Mhm.
life and death, especially when you're facing a serious illness.
Yeah.
It's that unease
Uncertainty.
and uncertainty about what it all means.
Yeah.
And I think psychedelics, by altering our perception of self and reality, might allow us to kind of reframe our relationship with death and really address that existential distress.
So it's almost like these substances could help people connect to a deeper sense of meaning and purpose,
Right.
even in the face of death.
Yeah, there's some research suggesting that psychedelics can actually enhance spiritual well-being, which can be incredibly comforting for patients who are dealing with end-of-life issues.
And that kind of leads me to something else that you mentioned in your notes, which is the potential role of psychedelics in gerontology.
Yeah.
Could these substances benefit older adults
Mm-hmm.
who are facing age-related anxieties and fears?
I think so.
Yeah.
I think it's definitely an area that deserves more research
Yeah.
because as we age, we face issues of loss,
Right.
isolation, and our own mortality.
Yeah.
And psychedelics, when used responsibly with the proper support, could be really valuable for navigating all of that.
Absolutely. Speaking of navigating challenges,
Yeah.
you highlighted microdosing
Right.
in your notes, and this is something I found really interesting.
Something-
People are experimenting with these tiny amounts of LSD or psilocybin,
Mm-hmm.
not to have a full-blown psychedelic experience,
Right.
but to kind of enhance creativity focus, emotional well-being.
Yeah.
Do you think that could have applications for oncology patients?
I think it's worth exploring.
Yeah.
The research is still preliminary, but there's growing anecdotal evidence that suggests there could be benefits for mood cognitive function, even pain management.
Yeah.
Imagine if microdosing could help patients manage those difficult side effects of chemo,
Right.
like the fatigue, the nausea, or just enhance their overall quality of life.
It's a really intriguing possibility.
It is, but of course there are potential risks and ethical considerations
Sure.
that we have to weigh carefully.
Absolutely.
We need a lot more research to confirm the safety and efficacy of this before we can say, okay, yeah, this is definitely something that we should be using for patients.
Yeah, and when we were talking about MDMA earlier, you mentioned some of the reported side effects.
Yeah.
From the PTSD trials, the anxiety, the fatigue, the changes in blood pressure.
Right.
It's important to acknowledge that these substances,
Yes.
while they're promising,
Mm-hmm.
they're not without risks.
Absolutely. Transparency is key,
Yeah.
especially when we're talking about vulnerable populations.
One thing that I was kind of struck by was that some participants in those MDMA trials reported feeling sensitive to cold
Yeah, that's interesting.
after taking the drug,
Right.
which seems counterintuitive because MDMA increases body temperature.
Right. It does seem counterintuitive.
So what's going on there?
Well, it highlights the complexity of these substances and how they affect the body.
Right.
So while MDMA does typically cause your body temperature to go up,
Yeah.
it can also cause vasoconstriction,
Okay.
which is a narrowing of the blood vessels.
Okay.
And that can make people feel cold,
Even though
even though their internal temperature is higher.
it's not just about the primary effects of the drug.
No, it's not.
It's about this whole cascade of physiological responses
Right.
that they can trigger.
You got to.
And that really emphasizes how important it is to have careful monitoring and medical supervision in a therapeutic setting.
Oh, absolutely.
We've talked a lot about the potential benefits.
Yeah.
But what about the risks of long-term use?
Yeah.
Is there any evidence of neurotoxicity or any lasting psychological harm?
It's a good question. I think it's really important to distinguish between recreational use,
Okay.
which can be associated with some risks,
Yeah.
and controlled therapeutic use.
Okay.
So the research on long-term effects of therapeutic doses is still limited,
Mhm.
but so far there's no clear evidence of any significant neurotoxicity
Well,
or lasting psychological damage from these controlled settings.
so it sounds like there's still a lot that we don't know.
There is, and that's why continued research is so important.
Absolutely.
We need to understand both the risks and benefits of these substances.
Especially in these therapeutic settings.
These therapeutic settings. Yeah, before we wrap up this part of our deep dive, I wanted to bring up something else that you mentioned in your notes.
The role of cultural and genetic factors in how people respond to psychedelics.
Oh, this is so important.
Yeah.
We know that genetic differences can affect how our bodies metabolize drugs, and that can really impact the intensity and duration of those psychedelic experiences.
Right. And on a cultural level,
Right.
different societies have different traditions and beliefs surrounding these altered states of consciousness. And these factors can influence how people interpret their experiences.
Exactly.
What might work for one person in one culture might not be appropriate for another.
Totally agree. A therapeutic approach that's effective in one cultural context might not be suitable or even safe in another context. So we really need to approach this field with cultural sensitivity and a deep respect for individual differences.
I think it's about finding that balance.
Yeah.
Embracing the potential
Absolutely.
while also being mindful of the risks and recognizing that individualized care is so important.
Couldn't have said it better myself.
Responsible and ethical use
Yes.
should always be our guiding principle.
Always.
We've covered so much in this deep dive. The science, clinical trials, benefits, risks.
Yeah.
It's clear that psychedelics and oncology, there's huge potential there.
Absolutely.
But as we kind of move forward with all this research, it feels important to really talk about the ethical considerations around their use.
You're right. We can't just ignore all the baggage that comes with these substances. They've been demonized, stigmatized for decades, often associated with, recreational use.
Absolutely.
And counterculture movements.
And that makes it even more important to
Yeah.
have these open and honest conversations about their potential therapeutic uses.
Absolutely.
As these substances are getting more mainstream attention, is there a risk of exploitation or hype, especially with vulnerable patients who are seeking new options?
That's definitely something that we need to be mindful of and make sure that patients are protected and that any use of psychedelics is rooted in good science and ethical principles.
We need guidelines, regulations,
Absolutely.
training for therapists, screening patients,
All of that.
maintaining the integrity of psychedelic-assisted therapy. It seems like informed consent is crucial.
Yeah.
These substances have such profound effects on consciousness.
Right.
People need to really understand the risks
Totally.
and the potential benefits.
Before they even consider this kind of therapy.
You brought up cultural appropriation in your notes, and you mentioned how many indigenous cultures have been using these substances for centuries in these sacred and ceremonial contexts.
Right.
So how do we make sure that therapeutic use doesn't exploit or disrespect those traditions?
That's such a complex issue, and it requires a lot of thought and sensitivity. We have to approach this with humility, recognizing the cultural and spiritual significance these substances have for many indigenous communities, and working with them directly.
Elaborate.
Incorporating their perspectives, that's crucial to make sure that any applications are developed ethically and with cultural sensitivity.
And then, of course, there's access and equity to consider.
Right, because will everyone who could benefit from these therapies have access, or will it only be those who can afford it?
That's a huge question that we need to address.
Absolutely. As we integrate psychedelics into healthcare, equity has to be front and center. We need to make sure that everyone who needs these therapies can get them.
Regardless of their background.
Regardless of their background.
This has been an incredible journey.
It has.
Exploring the science, clinical applications, potential benefits, risks.
The ethical considerations.
The ethical considerations.
Yeah.
It's clear that psychedelics and oncology hold a lot of promise.
A lot.
But we need to move forward cautiously and thoughtfully.
Absolutely. Always putting the well-being of the patients first.
We've learned so much about set and setting.
Right.
The potential of MDMA and psilocybin to help people navigate those really tough existential questions.
It's really quite amazing.
We've gone deep into the brain mechanisms.
The molecular level.
Yeah.
It's fascinating.
And we talked about how important personalized medicine is.
Absolutely.
And we've really grappled with the ethical complexities of bringing these powerful substances into healthcare.
It's not simple.
We hope that this deep dive will encourage you to keep thinking about these questions.
Yes.
Could psychedelics revolutionize cancer care?
That's the big question.
Could they change our relationship with suffering and death?
We'll see, but the future of psychedelics and oncology is definitely full of potential.
It's exciting, and it requires ongoing research, ethical reflection,
Absolutely.
and these open dialogues.
Yes.
Thank you so much for joining us on this deep dive.
It's been a pleasure.
We want to leave you with one final thought.
Okay.
If these substances can help us face our deepest fears and find meaning even when facing death, what other possibilities might they hold for us as individuals and as a society?